Hi, I'm Dr. Raymond Fritz, and I'm here to talk a little bit about my journey and how I became a podiatrist and how the passion for podiatric medicine came about for me. I started out in the military. I was a Navy SEAL corpsman and seen a lot of lower extremity injuries. So I already had an awareness for the importance of the foot. One thing led to the other, nothing was planned. Went Marine Recon for a while as a corpsman and then went through the SEAL pipeline. That's probably one of the greatest experiences I had. We always said you take care of your equipment and it'll take care of you. And I kind of look at feet the same way. If you take care of your feet, they'll get you where you need to go. Went to Muhlenberg College for undergraduate. I was a track guy and I had an injury for 2 years. I had a chronic tendonitis. And then a change happened. I seen my first podiatrist. Instead of just treating the symptoms, he identified the cause, which was my foot mechanics. And that was the reason for what I had, which was a chronic posterior tibial tendonitis. That podiatrist made me a set of custom orthotics that addressed my foot mechanics. Within 4 weeks, I was back on the track. That year, I broke the school record for the cross-country course. Little did I know at the time that there's so much more to podiatric medicine, as I would later find out, surgery. So from Muhlenberg College, I attended Temple University. I got my Doctor of Podiatric Medicine degree. At the completion of my residency, I went back on active duty, went right directly to the Bethesda National Naval Medical Center, Department of Orthopedics, and opportunities were there. I ended up becoming the first podiatric director of a residency for the Navy. I also got a little ride to the Middle East on USNS Comfort. Anyhow, time passes. I started private practice. That was great. Started as a solo practitioner, and we've grown to 7 doctors, 3 offices. Now, during this time, continued my service as a podiatric consultant to Naval Special Warfare, and eventually I retired in 2001 as a commander. Here we are. I'm still plugging away. I'm an old guy. If I look back, my journey started as a 17-year-old when I signed up for the Navy, but that moved me along. It moved me down that medical pipeline because I got a lot of experience. I worked all over the hospital, emergency room, intensive care, and then eventually as an independent guy in the field. So here at Allentown Family Foot Care, it doesn't make sense for somebody, especially somebody who's working on their feet. They can't walk, they're limping, and they can't get an appointment because we can make things happen quickly. And that was part of my job as a consultant to SEAL team, and taking care of some of the toughest problems in a population that needs to get back very fast.